Okay, so we're doing special tests of the elbow. The first test we're going to do is the valgus stress test of the elbow to test for the UCL or the integrity of the UCL. So how you're going to do this, you're going to have your test hand on the lateral aspect of the patient's elbow and then feeling on the medial side of their elbow with your other fingers to feel for gaping of the elbow joint. And then your other hand you're going to have on the distal forearm. And what you want to do between 0 and 30 degrees of flexion, you want to make sure that they're relaxed. You want to apply a valgus force at the elbow and a varus force at the distal forearm, and then feel for gaping or look for gaping around the medial epicondyle. And that's the, pain or noticeable gaping is going to be a positive test for the valgus stress test of the elbow. Okay, so now we're going to do the pronator teres syndrome test. So we're looking mainly at the median nerve and when it splits through the heads of the pronator teres muscle, sometimes with hypertrophy of that muscle or a direct blow to the area can cause like a neuropathy type pain and issue with burning, stinging, or tingling down into the distribution of that median nerve down the forearm and into the hand. So how we do this test is we have the patient sitting or standing. Standing is a little bit easier. We have their elbow flexed to 90 degrees like this. And then what I'm going to do is I'm going to supinate her arm, her hand, and her forearm. And then she's going to resist me by pronating her arm and forearm. And so after you instruct the patient on what she is going to be doing, then you'll let her know when you want to start the test. And so we'll start 1, 2, 3. And then she's going to resist my supination and squeeze my hand like a handshake. And a positive result of this test is going to be burning, stinging, tingling, any kind of nerve sensation down the distribution of the median nerve. Okay, and for our last test, we're going to do a test for medial epicondylitis, otherwise known as golfer's elbow. For this test, what we're going to do is, we're going to do the passive medial epicondylitis test. For this, we're going to make sure that their forearm is supinated. We're going to put our hands on their medial epicondyle, kind of on the distal portion and the attachment site of the flexor pronator group. And what we're going to do is we're going to put her hand overpressure on the origin, so on that medial epicondyle, and then we're going to passively bring her hand or wrist back into flexion with overpressure, and then feel for pain at that medial epicondylitis spot.